Hello, my name is Matt Salmon, and I'm the president of the Electronic Cigarette Association. We formed our association a few months ago to be responsible players in the e-cigarette industry, to make sure that our members do not market our products as smoking cessation devices, nor do we make any health claims whatsoever. We market our products to committed long-term smokers as an alternative to combustible tobacco, which is a known killer of over 400,000 people in our country alone every year. Second, anybody who joins our association cannot market to children. I listened with great interest as the FDA held its press conference on July 22nd to talk about their new position regarding electronic cigarettes. Frankly, they didn't adopt any new policy changes. It seemed a lot more about public relations than it did public health. Otherwise, why would they have held this study for several months, including during the time that the Congress debated the most important smoking or tobacco-related legislation in a generation? Where was the FDA with this report? Non-existent. This report sat collecting dust. When they were asked repeatedly why they were bringing this report up now as opposed to earlier, they said, well, we're just very concerned about public health. Well, why weren't they concerned about the public health 3 months ago when this report concluded? This report was so narrow in its scope and focus, there's no peer review, and I have to believe that because of the timing and the fact that they sat on the report for 3 months and did not include it in the most important debate on tobacco on Capitol Hill in a generation, they hid that report. I have to believe that the motives are somewhat other than the ones that they discussed yesterday. We need to get back to a true debate about public health. And we, at the Electronic Cigarette Association, we stand ready to work with the FDA. If they have concerns about the manufacturing process, we're willing to work with them. We think that that's reasonable, and that's a positive thing. If they're concerned about marketing to children, we have that same concern. We're willing to work with the FDA to make sure that children don't have access to these products, because we don't want children on our products. We want to make sure that only long-term committed smokers use this product.